Right, back live with you tonight. John in Focus. Reporting continues now. ActionSA member of the Gauteng legislature, John Moodey, says he and two of his colleagues were refused access to the Sebokeng Hospital this morning. Moodey says he went to the facility to conduct an unannounced oversight visit, but was blocked and threatened with physical violence by unidentified individuals. He joins us in the studio now to tell us a little bit more. Good to have you, and thank you very much for your time. You've posted a little bit of the ordeal on X, and it caught a lot of attention as well. The objective of going to the Sebokeng Hospital, why did you initially want to go there?
Well, we've received a number of complaints from the residents of Sebokeng about the poor treatment that they receive at this facility. And it is with that intention to go and have a look and see what it is that the normal patient would be experiencing at this hospital and on a first-hand basis. Now, Section 55, subsection 2 of the Constitution gives legislators that authority of oversight over the executive. Yeah. And it also speaks to it being announced and unannounced. Incidentally, I do know who the people are who confronted us and refused us entrance. I've got their names, and I'll announce that a little later. Even though it was an unannounced, in a sense, unannounced visit, our researcher, however, had sent an email to the district office director informing him about the fact that we'd like to go there and that we would be there this morning at 9 o'clock. He then didn't get any response, but he had spoken to the director also telephonically together with our provincial secretary, who indicated it's fine. Yeah. So when he didn't get a response by Friday, he wrote again. And then he gets a response from the executive assistant to the MEC's office that says they will tell us and come back to us with a date and a time for us to go and do the oversight. Now, the MEC doesn't tell the legislature, the executive doesn't tell the legislature what to do. It's a
different number of government.
Different level of government. Yeah. We have oversight over it. So Rule 30, subsection 3 of our rules in the legislature speaks to the very fact as 55.2b of the Constitution that gives us the right as legislators in the interests of the public to go and actually see and have oversight over the executive in terms of how they are operating, etc. So that we have first-hand experience to be able to ask the necessary questions in terms of what we have found there, and also to praise where we see things are good and happening. I mean, just last week and Thursday, my committee and I'm the chairperson of SCOPA went to 2 hospitals. We went to Kopenhagen Hospital in Vereniging, no problem, unannounced, no problem. We got absolute good response from the CEO. We took up 30 minutes of our time. We asked, could we speak to someone else, an IT person, because we looked for something specific. We got to Charlotte Mackay Hospital, almost the same type of thing. However, because we were the committee, there was a delay for a long time. I said, we're not going to be here for too long. We just want to speak to the IT issues in terms of the response from the Auditor General's findings. And then get told by some of those officials that the MEC had actually given instructions that we shouldn't be there. Wow. So this just adds on to it. Now remember, this oversight that we were going to do was already planned before this oversight that I had as a SCOPA chair. Yeah. I identified myself. We weren't in ActionSA regalia. Yeah. We identified ourselves as members of the legislature.
What happened when you got to the gate? Go to the gate, you say,
no, we got through the gate, no problem with security. So when we parked in the parking lots, we waited for the other colleagues to arrive. And whilst we were there, we were accosted by 3 gentlemen. The one gentleman then introduced himself as Mr. Rakatsa Setai, as assistant director. And he said, his words were, you are not supposed to be here, you're supposed to be stopped at the gate already. You weren't supposed to even be allowed in here. But we had visitors tags because we went in and did the normal thing. We didn't want to bypass any legislation or any of their processes and procedures. I said to him, on what grounds? Because he was instructed by his bosses that we won't go in. So I then asked the gentleman, and who are you? He said, I'm the head of security. I said, but I have a right to be here. I've introduced myself, and you see that I'm actually in it's not ActionSA regalia, but in legislature regalia. I'm not here on party work. I'm here on legislature work. That is when they said, you will not go in here without the permission. Not at all. And I said, well, I'm not going to stand in the sun here in the car park. I'm going to go in to the building, and we can discuss the issues there. They said that you won't take a step further. I said, are you going to arrest me? I then produced my legislature card, and I said, I'm identifying myself as a member of the legislature. And I'm identifying myself as a South African citizen. I have a right to go in there. They say, no, unless you have an appointment, you're not going to go in there. I said, okay, I'm going to go into casualty because I suffer from migraine. And you've just given me a migraine. He says to me, where's your reference letter? I said to him, I don't need the reference letter. I'm going into casualty.
Right.
He physically stepped in my way as I was walking. The security chief, as he called himself, well, the head of, addressed me as chief. I said to him, I'm nobody's chief. I'm a servant of the people. You call me sir, as I'm calling you sir, or you call me Mr. Moodey. But you don't call me chief. Please, let's have respect for each other here. And I'm going to the building. They physically prevented me or tried to prevent me from going further. I was with two colleagues. That is Funzi Ngubeni, our caucus leader, as well as Emma More, who serves on the committee for health.
Yes.
And I then proceeded. And this Mr. Setai stepped out of the way. The security officer pushed me. I said to him, sir, this is the second time you're touching me. This is an assault. So you're either going to arrest me, but if you're going to touch me again, I'm going to defend myself. And then we walked to the buildings. When we got there, they closed all the doors. I said to my colleagues, we're not going to disrupt the hospital's
They are patients, I suppose.
We're not here for that reason.
Yeah.
We moved away so that the patients could go in.
Right.
They kept us standing there for over 40 minutes. And then constantly waiting for the director to come. They called the police. The police came and tried to intimidate. We said, on what grounds are you going to arrest us? They said, trespass. I said, trespass in which way? I'm a South African citizen. I have a migraine. I want to go in here. And besides that, that's not the reason why I'm here. But I'd like to see a doctor if I could, because I don't have any pain tablets with me. However, I'm a member of the legislature. So on what ground are you going to arrest me or remove me from this premises? Yeah. They realized that they didn't have a case, and they left. They brought up the security, these security wardens, crime wardens, traffic wardens. Yes. Those people are not certified. Yes. They don't have an appointment card. They are not certified peace officers. They have no powers of arrest, nothing whatsoever, unless they're working with SAPS or with a peace officer. They came to threaten as well. They then brought those people from Nahau out in uniform, some of them, and they started intimidating. These very gentlemen, Sakai and that security officer, were dancing with them. We have it on video. Yeah.
So you essentially blocked as a member of the legislature to conduct oversight. Yes. It's ultimate oversight.
Yeah, and refused hospital treatment, incidentally.
Have you written to the MEC on this?
I haven't written to the MEC as yet. But I will definitely be raising the matter in the House. Yeah. Because that is where it is. In the House is where the MEC has to then give account to the legislature. Right. I'm a legislator. I am not just an ordinary citizen. I am a servant of the people elected into public office to oversee the executive and to ensure that they get the services that they deserve. Yeah.
What were you actually going to look at? I mean, were there particular areas that you wanted to have a look at?
Yes, people were talking about the fact that when they get into the hospital, into casualty, where you get into the first waiting area, that they wait there forever. Now, the e-filing system or the e-patient system, which I was talking about, that we actually went to do oversight on last week, should alleviate that problem. So that was one issue we were going to look at. There was also reports to us from patients even after we had left the hospital, but prior to that as well, that they can sit there and wait for up to 18 hours without being seen to by a nurse or a doctor. So when you have this type of report to you, given to you, Of course, you go and you investigate. In fact, last week when I was in Kopenhagen Hospital, there was a lady with a son who was severely beaten up, and he was laying on her lap. They had casualty. With his drip not up on a pole, it was hanging, right? And I asked the lady, this young man is in pain. When did you come here? She said to me 9 o'clock yesterday. I said in the morning or in the evening? She said to me in the morning, and this was already 11 o'clock, about 11 o'clock in the morning.
The next morning?
Yeah. The matron was with me. In fact, the CEO was with me. And I said to her, ma'am, can we just address this matter here? I must tell you that hospital was clean.
Yeah,
It's open, it was clean.
So what do you think is being shielded here? Why didn't they want you to go into this hospital?
Well, let me tell you something. Our health system is in disarray. And if a person just looks at the very bad audit report once more, it is year in and year out.
Yeah.
This is the first term that I'm serving as a chairperson of SCOPA or on SCOPA, but I've looked at previous Auditor General's findings and the past financial year's findings. It is in disarray. Let me tell you, there is fruitless expenditure, there is unauthorized expenditure, there is a waste of money, quite frankly. Money that could be better utilized to give our people better services. And I can tell you now that the actions of the executive assistant to the MEC speaks to the MEC because he speaks on her behalf.
Yeah.
And I'll be taking on this matter.
Right. Mr. Moodey, I appreciate your time. Thank you very much for coming in. You've mentioned how you've mentioned the department itself, so we have to reach out to them and actually get them also to respond to this matter and give them a right of reply. But thank you for coming in and your intervention this evening.
My pleasure. Be here to serve.
John Moodey. He is an MPL in the Gauteng legislature there.